A lot of people ask me if they should get private health insurance, but what I'm finding is a lot of people don't know how private health insurance works and if it would benefit them financially. So let's start by busting a couple of myths. Having private health insurance doesn't mean you avoid the Medicare levy of 2%. It means you avoid the Medicare Levy Surcharge. However, the surcharge doesn't start until you're earning over $90,000 a year for singles and $180,000 combined for couples. Have a look at the chart up here to see if you fall within the earning thresholds for the Medicare Levy Surcharge. So if you're thinking about getting private health insurance to save 2% off your tax bill each year, you have it wrong. Next, having private health insurance doesn't mean free healthcare. If you are a private patient, Medicare will cover 75% of the cost outlined under the Medicare benefit schedule, and your private insurer will cover the remaining 25%. However, if your doctor charges more than the schedule, well, that gap there is for you to cover. There can also be an additional gap to pay where you use a private hospital and your insurance doesn't cover ward, nurse, or theatre fees. You can always ask for a quote from your doctor or hospital to check it against the MBS so you can make an informed decision around how much gap there will be to pay. There are some advantages, though, of getting private health insurance. If you get the cover before turning 30, you'll be entitled to a discount that lasts until age 40, and you avoid ever having to pay the lifetime health cover loading. See the discount chart up here and see that you can get up to a 10% discount by taking out cover at age 25 or younger. The government gives you rebates as well for taking out private health insurance, with a 24% discount for those under the surcharge threshold up here yet again. And if you don't live in Queensland or Tasmania, you're probably also going to need to look at ambulance cover on top of your private health insurance too. You should also consider if you're going to want private health insurance in the future, as premiums will increase by 2% for each year over 30 you wait to take out the cover, which is part of the lifetime health cover loading. And that loading sticks around for 10 years and doesn't form part of the private health insurance rebate from the government. So if you think you're going to be hitting those surcharge earning thresholds, you may want to consider taking out the cover before you turn 30. If you are earning under the threshold, you need to consider whether or not you'll be willing to cover the gap to go private. Otherwise, you could just be better off saving the premiums. If you're earning over the threshold, it still might be worth taking out that policy sooner rather than later to avoid the health cover loading. If you want more information about taking out private health insurance, the government actually has a fantastic website for this. So visit www.privatehealth.gov.au. Thank you.